Hi, good morning Callum. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 15th of December 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Callum King.
Alright Callum, could you please confirm your candidate number?
Yes. My candidate number is 431332234.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Introduce yourself.
Hello, my name is Callum King. I'm a nurse from the Philippines. I've been working in healthcare for 8 years, and I'm currently taking the OET to register as a healthcare professional in the USA. I'm excited to be here today, and to have the opportunity to demonstrate my English language skills.
How long have you been working as a nurse?
I've been working as an ICU nurse for 8 years. I started my career in the city hospital, and then moved to Dubai 4 years ago. I've gained a lot of experience, working with different nationalities, and I'm passionate about providing high-quality care to my patients.
Why did you choose to become a nurse?
There are a few reasons why I chose to become a nurse. Firstly, I've always been interested in healthcare and helping others. I find it incredibly rewarding to be able to make a positive impact on people's lives, especially when they're going through a difficult time. Secondly, I enjoy the challenges and problem-solving aspects of the job. Every day is different, and I'm constantly learning new things. Finally, I appreciate the team spirit and sense of community within the healthcare profession. I feel like I'm part of something bigger than myself, and that's something I value.
Why did you choose to take the OET?
I chose to take the OET because I want to work as a nurse in the USA. I believe that my skills and experience would be valuable to the healthcare system there, and I'm excited about the opportunity to live and work in a new country. The OET is a recognized English language test for healthcare professionals, so it's essential for me to pass it in order to register to practice.
What are your hobbies and interests?
Outside of work, I enjoy music and cooking. This helps me to relax and distress after a long day. I also find it important to do yoga and running to maintain work-life balance. I believe that having a healthy work-life balance is essential for my overall well-being and allows me to be a more effective healthcare professional.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Thank you, Mihiraa, for allowing me to examine your son Marshall. I am sorry to say that he has developed some new rashes and blisters on top of his existing eczema. Can you tell me a little more about how these started?
Yes, they just appeared yesterday, on top of the eczema patches that have been there for about a week now. They're red and bumpy, and Marshall keeps saying they itch terribly.
I see. I can imagine. That's quite uncomfortable for him. Are there any specific areas that seem to bother Marshall more?
They're mostly on his arms and legs, but there are a few on his face too. It seems to be getting worse as the day goes on.
Thank you for sharing that. Have you noticed anything that seems to make the rashes worse, or anything that might have triggered them?
Well, we've been using the same emollient cream for eczema, and I thought maybe that could be irritating. Marshall also had a bit of a cold last week. Could that be related?
That's good information to know. Mihiraa, it's possible the emollient might not be suitable for these new rashes, and sometimes infections like a cold can worsen eczema symptoms. To be safe, I'd recommend stopping the current emollient for now.
But what will we use to soothe the eczema then?
Don't worry, I have a plan. Given the appearance of these new rashes and blisters, Mihiraa, I suspect there might be a bacterial infection involved. So, I'd like to recommend a 7-day course of antibiotic cream to help clear things up. I'll show you exactly how to apply it to ensure it's effective.
That sounds much better. Is there anything else I can do to help Marshall recover faster?
Absolutely. Practicing good hygiene is crucial. Mihiraa, we need to make sure Marshall washes his hands frequently, especially after scratching the itchy areas. We'll also need to gently clean the affected areas with warm water and a mild soap. Keeping his bedding and clothes clean is important too. I can show you how to do all this effectively.
Thank you so much. I appreciate the help.
You're very welcome. Since these new symptoms might make it difficult for Marshall to participate in certain activities at school, it's important to let his teacher know. This way, they can provide any necessary support and adjustments.
That's a good point. I'll definitely inform the school.
Lastly, Mihiraa, I recommend scheduling a follow-up appointment with your doctor within the next few days. This will allow us to monitor Marshall's progress, ensure the treatment is working well, and rule out any underlying causes for these new symptoms.
Thank you again, Nurse Callum. You've been so helpful and reassuring. I feel much more prepared to help Marshall get better.
It's my pleasure. Mihiraa, let me recap our discussion for clarity. Marshall's new rashes and blisters emerged yesterday, intensifying discomfort and itching on his arms, legs, and face. Given the escalating symptoms, the current emollient may not be suitable, and a bacterial infection could be a factor, especially considering his recent cold. To address this, I suggest discontinuing the current emollient and initiating a 7-day course of antibiotic cream. Essential practices include maintaining good hygiene, frequent hand washing, and thorough cleaning of affected areas. Informing Marshall's school about his condition is advisable, and scheduling a follow-up with the doctor in a few days will allow for proper monitoring and reassessment.
That's perfect, nurse.
Mihiraa, please remember, we're here for you and your son. If you have any questions or concerns, don't hesitate to reach out. I wish him a speedy recovery.
Thank you, nurse. That is the end of your OET-speaking role play. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.